question when you're here, huh? Yes, of course. I hope by the time that you leave this clinic, you feel even just the littlest bit better. Okay? So we have just a little bit of paperwork to get out of the way before we move on with our treatment. It'll be quick, I promise. Would you mind just confirming your name and date of birth for me? Very good. And is that your preferred name? How do you like to be addressed? Excellent. Very good. Thank you. I'm going to ask you some questions about your headache, about the pain you're experiencing, and symptoms that are going along with it. How long has this headache lasted for you so far? Okay, and is that typical of headaches in the past of this nature? Thank you. And on a scale from 1 to 10, with 1 being no pain at all, and 10 being the most severe pain you've ever experienced, how bad is your pain? Okay, and is that also typical of headaches that you've gotten of this nature in the past? Okay. And where is it that you feel the headache? Where do you feel the pain? Okay, I see. All right. And is that pretty typical as well? Okay. Is there anything that you believe could have triggered this headache? Some people know that if they eat something or consume caffeine or exercise hard, that they may trigger a headache. Do you know of any triggers? Okay. Okay, and is that generally the catalyst for headaches of this type for you? And how often do you get these types of headaches? Is it quite a chronic problem or just more once in a while? Okay, so they have increased in frequency as of late. And how many would you say, on average, do you have a week, or if it's not so much a week, a month? Okay. Very good. And are you experiencing any other symptoms that are going along with this headache? And do you also get these symptoms with your other headaches as well? Okay, very good. So that ends our questionnaire. If you wouldn't mind, I'd like to map out, if you will, the area of pain and do a little bit of palpation, okay? For that part, I will have to touch you. Is that okay with you? Do I have your permission to do that? Okay, very good. So you just let me know if you feel any pain or tenderness, okay? So let's start along the hairline. Okay, so this part is certainly tender. Okay, and if I go around the ears, is that as well? Yes, okay. And if I follow that back, is this also tender? Yes, okay. And on this side. Okay. And if I come up here, more towards the top of the head. Okay, so at the very top of the head, there's a bit of tenderness as well. And what about the back? Back of the head here. Okay, definitely in there as well. So that already covers quite a wide expanse, right? And what if I come down the forehead? Okay, so along the forehead here, right? And is that sensitive to the pressure as well? Okay, and I'm going to feel along your nose and your cheeks here. Any sensitivity or tenderness in this? Not along the nose. And what about along the cheeks here? No. Okay. And I'm just going to very lightly tap along your nose, your cheeks, and your forehead here. I want you to let me know if there's sensitivity in that. Anything here? No. And what about down here? If I tap along here? No. And if I tap along here? No. Here? No. Okay, and I'm just going to do a little bit more bilateral tapping here. Anything? No. Okay, very good. And I'm just going to feel around your jaw here. Okay. How does this pressure feel? Okay. Yes, that muscle is very, very tight. Are you clenching your jaw right now? Yeah, against the pain. Okay. Right. And I'm just going to feel around your eyes. I'll be very careful to avoid the eye itself. Please let me know if you feel any pain or tenderness with this. Anything here? No? Okay. And I'm I'm just going to press along the temples here. Anything with this? No. Okay. Now I'm going to move to the neck. Okay. So if you could just tell me if you feel any pain when I press along the neck here, the sides of the neck. Is there any pain upon that pressure? No. Okay. And if I come down to the shoulders, what about here? Okay, as I came down, there was a bit. Okay, let me feel along the neck. I may have had a little bit of a light hand. Okay, I see. So it's a little bit more pressure. That is a bit tender. Okay, coming back to the shoulders. How is that? How does that feel? Okay, not so much. Okay, very good. I'm just going to take a couple of notes real quick. There are several different types of headaches, and based on your answers and based on the sensitivity of your muscles, of the structures along your head, I believe we can comfortably say that you seem to be dealing with a tension headache. Now, tension headaches tend to be the most common headaches, and oftentimes these are characterized by a tight feeling, like a hat that's too tight on your head, that forms in a band along your head. Oftentimes people will also feel sensitivity and pain when pressing along their forehead and the neck, oftentimes into the shoulders as well, but you didn't have that. So tension headaches can be caused by stress. Oftentimes it can also be caused by some structural issues. So sometimes things in the neck and the head get a little kinked up, whether it's sleeping on a pillow that's not doing very many good things for us, or it's holding your head in an odd position, or sometimes we even get them from TMJ pain, that you're clenching those muscles so tight. We can see tension headaches come up when we're working with the jaw. Okay, so luckily tension headaches are quite treatable, and while they are what's known as a primary headache, where the headache is the symptom and the disease as opposed to a symptom of something else, it is painful, but it shouldn't really cause you harm. So that's something good. It's not a sign of something bigger, and it won't cause you any lasting damage. It's just really uncomfortable. Okay? So what we can do for you today is oftentimes we treat occasional tension headaches with over-the-counter medicines like ibuprofen or acetaminophen or aspirin. But that's based on if you wish to take that sort of medicine. Some people have some sensitivity Some people don't really respond to that at all. So here in the clinic, we can do a topical analgesiac, and we can do some stretching and massage to help ease that pain. Okay? So should we run into chronic headaches, then we start looking into physical therapy to look for any structural abnormalities and diagnose and treat those. And most people have at least a reduction of symptoms, if not completely cured of symptoms. I'm one of those people that if I don't keep up on physical therapy, then tension headaches come back in. So it is very beneficial. So our topical analgesiac is a ointment, not a liniment. This particular one is an ointment. And this contains camphor and menthol that work as a local anesthesia, basically. So some people use the topical absorbing. Some people use icy hot. Some people use lidocaine. All of these are topical analgesiacs and help numb the area and help reduce the pain. So we're going to be putting the analgesiac along your neck and your shoulders. And sometimes when we have the structural issues causing the headaches, then we may see a reduction of symptoms shortly after we apply the ointment. Okay? So we can certainly do that if you're comfortable with it. It's skin safe and usually lasts for about an hour or so. Okay? So let me go ahead and jot. It has a nice menthol smell to it. Do you like the smell? Okay. There. Yeah. Very nice and refreshing. So, I'm just going to take a little bit on our little stick here. And just pop it on the back of my hand. Now I'm going to be applying this to your neck and shoulders, okay? And it has a bit of a Vaseline-like quality. So by the time you leave, we will get you all wiped off. That you're not leaving with a shiny, sticky neck. You just want to apply a good layer. Sometimes tension headaches also respond to heat or cold compresses, and this ointment has the added bonus of feeling both cold and hot. So sometimes that can help as well. Okay, a little bit more. I'll just work this along the shoulders here. Good. Okay. Excellent. So, how is that feeling for you? Is that starting to work? It may feel a little strange that a part of your body that you're not necessarily acknowledging all the time, but definitely know that it's there, all of a sudden starts going kind of numb, kind of tingly, kind of warm, kind of cold, all at the same time. Okay? Alright, so we're going to start with some stretches, and hopefully this will help both warm up the tissues and get rid of that tension a little bit. Okay, so first off, I want you to think about where your shoulders are at. Are they hitched up to your ears, or are they relaxed down? Are you holding them up, or are they just sitting just nice and loose? Okay, so what I'm going to have you do is I'm going to have you pull your shoulders down and make sure that they're sitting down and loose. And then we're going to roll the joint back. Okay? Back and down. You might feel a little bit of crunching or grinding in the joint. That's okay, as long as there's not any pain, or it's just for a second. We're going to roll our shoulders back and down. This will help widen the chest area. It'll help lower your shoulders and create some space between your ears and your shoulders so that we're not hitched up close to the ears. Okay? Sometimes it does help to just lay our fingers on top of our shoulders and feel it as we roll it back and down. You might feel a pull along the chest, feel the shoulder blades draw together. Just do that a little bit. Just roll it back and down. Okay? Alright, so I'm just going to reach over and press my hands down on your shoulders and make sure they are as low as they can be. So I'm just going to reach over here and just push your shoulders down. Okay, so you rolled them back and down enough that they're not going any further, so that's good. So next I want you to think about your jaw. Is it tense? Is it tight? Are you clenching your teeth? So, if you'd like, you can open and close your jaw a couple of times. I personally like to place my fingers right at this little space. You'll feel kind of this divot by the ear. So if you feel your tragus and go up a little bit, there's this little divot on each side. And if you open and close your jaw while your tongue is touching the roof of your mouth, it's a good little stretch. Okay? Alright, so when you have acknowledged where your jaw's at, you've done a little bit of stretching, just waking up that area a little bit, I want you to do something a little silly for me, okay? So I want you to cluck your tongue, just like that. Alright, when you've done that, wherever your tongue went to when you clucked your tongue, that spot on the roof of your mouth is where you want to rest your tongue, okay? So I just want you to press your tongue to the roof of your mouth in the spot where it went to when you clucked your tongue. And then I want you to just let your jaw relax. Your teeth are a little bit apart, and your tongue is right on the roof of your mouth, keeping it open just a little bit. Okay, that'll help reduce some of the tension in this area. If we have that space between our teeth, then we won't have the pain from clenching the jaw. Now, another thing you can do if that feels a little odd to you, you can push your tongue in between your teeth like that and just close your lips so that your tongue is acting as a buffer and creating that space between your teeth. With that one, you do have to be careful that you don't accidentally bite your tongue, okay? There's a couple ways to create space there. And next, we're going to do a little bit of stretching with the neck, okay? So I want you to kind of feel where your neck is at. Is your head pitched forward? Are you feeling a bit of curve in the neck? Can you try to make sure that your neck is straight, that your head is in line with the rest of your body and isn't craned forward? A lot of us just naturally move our head forward. The more forward we move our head, the more strain it puts on the neck. Our necks are this tiny little stick holding up the bowling ball of a head we have. So it might just feel a little bit better to consciously move your head back a little bit. You might feel a little bit of lengthening in the spine. Okay? And then I want you to draw your head all the way forward. Try to touch your chin to your chest. And then all the way back. Go forward as far as you can. And go back. Forward. And back. Good. Now we're going to turn our head. So I'm going to go to my right as far as I can. Back to neutral. And then my left as far as I can. Back to neutral. I want to do nice slow movements, okay? Going towards my right. Back to neutral. Going to the left. Back to neutral. Towards the right. Neutral. Towards the left. Neutral. Okay. Lastly, we're going to tilt our head a little bit. I want you to take your hand and just reach it towards the ear, so you can go just above the ear or more towards the top of your head. And I want you to just relax your arm and let the weight tilt your head down towards your shoulder until you feel a nice stretch in the neck. We'll do that to the other side. Just let your arm be a little bit of weight that pulls your head down. We're just doing this for a few seconds, getting a nice stretch the neck. Not trying to yank her head, not trying to force it. Just letting our head go down a bit, aided with the weight of our arm. Okay, very good. And it might help at the end just to shake things out a little bit to make sure your shoulders are rolled back, make sure you've made space in the jaw between the teeth, okay? Alright, how does that feel? Yeah, oftentimes we feel a little drowsy or fatigued after that. When we do just these brief, slow stretching exercises, it helps to sort of ground us to the moment because we're honed in on the sensations, on the little bit of stretching, maybe the tiniest bit of pain or discomfort. We're just taking it real slow and exploring the body's range of movement. Okay? So lastly, we're going to do a little bit of massage. I know these areas are pretty tense for you, and a little bit of massage can help release that tension, okay? You just let me know if it's too much or if it's not helpful, okay? So we're gonna start along the face. We're gonna start with the forehead. You can allow your eyes to drift closed if you'd like. Sometimes the best cure for a headache is a little bit of rest. You're more than welcome to just relax or even fall asleep. Just working in circles over the area. Not trying to do anything fancy. We're just moving the skin around, adding a little bit of heat. Just trying to get the tension to release a little bit. Okay, by the temples, I'm not going to put too much pressure here. Many people don't like a lot of pressure in the temples, but we do often get some tension in the temporalis muscle. This is a very important muscle in addition to the masseter for chewing and talking over our jaw movement. So it can get pretty tight as well. Good. So allow yourself to relax. Allow yourself to just feel the sensations, the massage. Try to just keep your jaw loose. Keep your shoulders low and loose. Sometimes they start trying to clench back up. we need to go back in and loosen that up. Okay, we're going to go to the jaw, down to the jaw here. Yeah, this is a very powerful muscle, and that means it also tends to carry a whole lot of tension. So we're just telling this muscle that it's okay to relax a bit. Sometimes some wires get crossed and it stays contracted and tight. I can just go in with one side and put a little bit more pressure in. The other side, put a little bit more pressure. How are you doing so far? Is pressure okay? We want it to be firm enough to be therapeutic, but light enough to not be painful, right? Sometimes these muscles can be quite sore and tender when they're being told to release and relax. Good. Just a little bit along the forehead. A little bit on the temples. And a little bit into the jaw. So now I'm going to work in to the head a bit, okay? So I'm just going to adjust my workstation. And that way I have enough room so that I can stand up. And then we're just going to do some gentle circles on the head. And when we're trying to reduce tension, a little bit of pulling and releasing often helps as well. Do a little pull on the hair, release, pull, release. But big thing is our finger circles. You can allow your eyes to be closed. Make sure your shoulders are relaxed and loose. Make sure your jaw is relaxed and loose. let me know if you feel that it needs to be a little more firm or a little more gentle. Just do a little bit of pulling, release, pulling, release. You can take a strand of hair and pull on it a bit. Another strand, just wind it around my finger, pull. Just taking some hair and pulling a bit. A little bit of pressure on the scalp often does so much to release the tension there. It's almost like it reminds the muscle that when it's supposed to be contracted, that pressure is what it feels like. When it's supposed to relax, it's when it's released. Some good finger circles, some kneading into the head, kneading into the scalp, not just moving the hair around, but moving the actual skin of the scalp. Just a little bit longer with our head massage before we move on to the shoulder and neck. Just a little bit more before we move on. A bit of just pulling, releasing, pulling, releasing, pulling, releasing, pulling, releasing, pulling, and releasing. Okay, so I'm just going to come back before you here. Alright, so how was that? Was that nice? Yeah? Okay. Well, now we're going to do a little bit of shoulder and neck massage. Just going to stay in front of you here since we're not focusing on it primarily as we did with the head and the face. We're just going to be doing little circles here and some pressure. With this, we have just a little bit of slide with the petroleum base of the ointment. And you might feel this warm up a little bit more since that petroleum tends to amplify the heat. So you'll feel that tingly little mix of cooling and heat while I just work on the structures. They're much more pliable when a little bit of Analgesiac is applied to them. Definitely a lot less stiffness and pain. It's too bad that we can't use that on our heads without making a mess, or our faces without running into those comedogenic properties. But the neck and shoulders, it works really well. Okay. Very good. And how is this pressure? Seems to be good. That's good. That's good. Right, and if we go into the shoulders here. Okay. Is that good as well? Okay. It's a lot less loose, or a lot more loose rather, than your neck, and certainly your head. Your head felt very tight, very tense. Doesn't surprise me that you were having some issues with headaches. Go up the neck and down along the shoulders. Up the neck, down along the shoulders. Up the neck, down along the shoulders. Good, 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 good. This pressure still okay for you? Good. It's good to hear. It's a little bit longer since we're not focusing here the longest amount of time, right? It's mostly along your head and face. Have you noticed a reduction in your symptoms at all? wipe off the remnants of the liniment, ointment. I'm not sure why I keep saying liniment. Very good. All right. So, just want to do a little exit interview with you here. So, on a scale from 1 to 10, with 1 being no pain at all and 10 the worst pain you've ever experienced, how severe is your headache pain right now? Okay, good. Good reduction in symptoms. And where do you primarily feel that pain? Okay, so a little bit around the forehead, the back of the head. Okay. And any other symptoms along with the headache that are going on right now? Remind yourself during the last bits of your headache to keep your jaw loose, whether you have to rest your tongue on the roof of your mouth to create some space, or you have to put your tongue in between your teeth to create some space between the teeth. You may have to just roll your shoulders back and down a little bit. Do a couple of little rotations here. Just make sure that they're loose. Stretch the neck a little bit, okay? And hopefully that'll keep those tissues from scrunching back up again and making that headache worse or last longer, okay? Do you have any other questions for me at all? Okay, very good. Thank you so much for coming to this headache clinic. I hope that it was helpful for you. I hope you have a whale of a day and a good rest of your night.